Hi and welcome. I'm trying to learn medicine today, arthritis, and after we've done what we're gonna do wrist training. And if you participate in a wrist training, then it's at your own risk. And we're talking about disease and also internal anatomy and the blood system. And this is no medical advice, we're just learning. And now it's arthritis, not arthritis. Arthritis is the next thing here listed. That is inflammation of the joints. We're having here now arthritis. Arthritis, A-R-T-E-R-I-T-I-S. Arthritis. That is an uncommon illness in which an artery or arteries is inflamed. Okay, but arthritis where an artery is inflamed. By arthritis, a general term for inflammation of a joint. So arthritis, inflammation of joint. Arthritis, inflammation of an artery. Arthritis may occur in small arteries, such as in the fingers, or larger arteries, such as the temporal artery on the side of the head. The temporal artery on the side of the head. Symptoms: pain in the region of the artery. An artery near the surface of the body will be tender. Duration: the symptoms are usually relieved quickly with proper treatment, but treatment may need to be continued for months or even longer to maintain relief. Okay, it is a pain in the region of the artery, and the artery can be felt from the surface as tender. And with treatment, the symptoms go away quite fast, but it can be necessary to do the treatment over a longer time. Causes: usually it is unknown what caused it, and sometimes arthritis is associated with other diseases, for example, rheumatoid arthritis. Okay, there's a difference between arthritis and rheumatoid arthritis. We're going to come to that later. Complications: if untreated, the artery may become thrombosed. Why? Because it is inflamed. An uncommon illness in which an artery is inflamed, arthritis. It is inflamed, and then it can make a thrombose, and then it's thrombosed. When to consult a doctor: if there is pain with tenderness in a particular area that persists for longer than 12 hours and has no obvious cause. Okay, if there's any pain for longer than 12 hours, you should consult a doctor. And what a doctor might do: look for underlying cause of inflammation and treat with anti-inflammatory drugs. Okay, we're going to look what might cause inflammation, and then there are drugs which can help against the inflammation. Outlook: with treatment, the outlook for arthritis is good. Okay, that was arthritis. Arthritis seems to be not so common. That is an inflammation of an artery. It can be at the fingers or also at the head, at larger arteries. And it is pain with tenderness at this region. And the symptoms are under treatment quite fast away, but it can be necessary to make the treatment a bit longer. The causes are unknown, but it can be through rheumatoid arthritis. If it's untreated, it can result in thrombosis, which is seriously. And the doctor should be consulted if there's pain somewhere and tenderness for a few hours. And there are drugs against it, and if it is treated, the outlook is good. Now that was the medical part. If you are here for medicine, you can go directly to the next part. Now, if you're here for wrist training, then you can stay and you can participate in this wrist training, but if you participate in wrist training, then it's at your own risk. Goodness, you have stance, arms next to us, and we're doing the spotlight, fists down and up. Again down. And up. And now, flashlight, fists, and then to the inside, and to the outside. And we're doing 3 rules. The first one is that we are stopping immediately as soon as there's pain, The second rule is to take out only as far as you can go with a little bit of effort. And the third rule is we're not overdoing it. We just want to strengthen, not to exhaust. We want to take a break, do it at any moment. Next exercise, the magician. Flat hands, bring them to the inside, not to the outside. We have quite a lot of exercises. If you like to skip one, you can do it. And the next exercise, the pancake flipper. Flat hands and bring them up. Closely. And now the rectangular cast. No, first the T-Rex in the morning. Flat hands out and bring them up. And down. And up. And now we're doing the curve in the morning. If you like to skip this exercise, you can do it. Fist next to us, we bring your fist down into flexion and press a bit against it. Pull a bit from the outside. Press a bit from the top. From the bottom. And now to the other side. Hand from the fist, bring it down into flexion. Press a bit against it. It's arthritis because arthritis because it's arthritis. Arthritis. Why is this arthritis? The inflammation of the joint. So we have to find it out. Because it can be quite helpful to not just, maybe it's in everybody. Next exercise, we're doing the rectangular castle architect. Both hands out the fist and bring them to the inside. And up. To the outside. And down. And the other way around, down. To the outside. Up. And down. And the next exercise, let's do the T-Rex in the gym. If you do it without a tennis ball, then just make a strong fist. With the tennis ball, press with moderate force on the tennis ball and release. And press again. Release and press again. And switch. And press. And release. Press. Release. Press again. And release. And now we're going to do for cautious big bend. Place the fingertips of one hand on top of the fingernails of the other hand. Press it and up slowly. Close again slowly. Switch. And now we're doing the frog testing the water temperature. You can skip this exercise again. Hands next to us and we're bringing them down with flat fingers. And then again up with strong fists. Again down, flat fingers. And again up, strong fists. Again down, flat fingers. And up, strong fists. And last time, down. And now, the third is new Synthesis director. Fists and open and close. And now, the basket bridge. Flat hands and bend the middle knuckles. Hold it and open again. Again, bend the middle knuckles. And up again. And last time. Next exercise. Take both arms in, strong fists into flexion. Now out, extension, flat fingers. Again in, strong fists, flexion. Out, extension, flat fingers. Again in, strong fists, flexion. And out, extension, flat fingers. Again in. And the last time out. Now the ice axe, flat hand, bend it into knuckles, and press on all 4 fingers. And release. And the other hand, bend it and press on all 4 fingers. And release. Now claw. Flat hands, and make claws. Hold it, and release. And again, close, and open. Again, close, open, and last time close, and open. And last exercise, the unfolding rocket boosters. Long arms with strong fists, and bring these fists into flexion. Now into extension with flat fingers. Again to the inside, flexion, strong fists, and out, extension, flat fingers. Again, inside strong fists, flexion, and outside extension, flat fingers. And the last round, inside strong fists, flexion, and outside extension, flat fingers. And landing, flexion. And now we're going with moderate force of the middle part of the lower arm. To relax the extension digital muscle of the triceps. On the outside. And that was the wrist training. I thank you very much, and until next time.